Well, thank you very much for the invitation to be here. Quite an august group here, so it's uh, a real privilege to be here. Thank you also for including implementation-related information in your deliberations, because that is not common to many meetings like this, where you're talking about evidence-based programs and the ins and outs of that. But how do you actually get these things into practice is kind of an afterthought. All of the panelists here have really been giving you the information that you need about some of the challenges being faced. Brian said that he was going to summarize his 15 years in 15 minutes. I'm going to summarize 45 years in the next 15 minutes. He said it might set his hair on fire, and now you know what happened. So, is it the top button, which?
Right.
Oop, I just turned it off.
Right button.
Right button. Ah, thank you. So the evidence-based program movement, there was some discussion about this yesterday, and I might warn you, don't blink, don't look at your stuff, because you're going to miss 5 years worth of stuff, because I'm going to go very quickly. But this is an international experiment. Where are the data? Who's done the randomized control trials that say if you use this evidence in practice, or generate all the randomized control trials, it's actually going to change human services? We have not seen that yet. So this is an experiment we're engaged in. The purpose is to produce benefits to children, families, communities. It's not to entertain researchers in laboratories. It's not to instigate nice intellectual debates. Not that those things are unimportant, but that's not the purpose. The purpose is to make a difference. A lot of talk about the science to service gap. Previous groups here at IOM have talked about this quality chasm. We know a lot. We're not using it in the community. We think this really, though, is an implementation gap. Yes, we do need to make use of this, but how are we going to make use of this? When we try to make use of evidence-based programs, practices, innovations, practice-based evidence in community and family settings, we don't do it as intended. So right away, why should we expect to have a good outcome if we're not making use of the program itself? Even when we do that, we don't sustain it beyond the 3 to 5 years that we have for funding. And even if we do that, as Brian and others on the panel here have just said, we do not take this to scale. We just recently read an article, we're going to scale for a particular literacy program in the United States. They took it to 28 schools. That was their scaling up. That's 28 out of the 90,000 schools in the US. I don't know that that would quite qualify as scaling up. What I want to talk to you about is applied implementation science. And applied implementation science includes looking at the intervention criteria, implementation stages and drivers, improvement cycles, implementation teams, and in the next 12 and a half minutes, you're going to hear something about each of those. It also, applied implementation science is really active, and it's based on the summaries of the research that have been done. Trish Greenhall and her colleagues in the UK recently recently 2004, I guess, maybe now, but came up with these categories of activities that people have tried, and we've heard some of these discussed in the last day and a half. But moving from letting it happen, I'm a researcher, I publish my stuff, I got it out there, you all read it and make the best use possible out of the research. That didn't work too well, so then we moved into the helping it happen. Well, we're going to have that, we're going to have manuals, we're going to have videos, we're going to have websites, we're going to have one-day workshops to get the word out. We're going to help it happen. And then both of these things are very, very valuable. So not to take anything away from this diffusion activity, this dissemination activity, but what we're going to talk about in the next few minutes is the making it happen. And this is not some heavy-handed kind of approach. This is really making purposeful use of what we're learning about implementation science and the use of implementation teams. Who is going to do the work of implementation? We know who does the work of interventions. It's the parents, it's the therapist, it's the teacher. Who does the work of implementation? So implementation teams then are the answer to that. And like I say, we'll cover all of those things. Formula for success. What is it that you need to take account of when you are planning to do any of this kind of work? One is, and we've heard a lot about this, you need effective interventions. Why would you do things that don't work? I mean, that makes no sense at all. So you need to start with something that is likely going to produce the impact that you want. Brian just gave a nice summary of some of the thinking that's gone on there in Pennsylvania. You also then have to have an effective way of putting that program into practice in the community setting, the school setting, the home setting, so that it is actually going to be delivering the outcomes that you're looking for. That requires also working in enabling contexts. If you're trying to do this and your organization doesn't support it, or if your organization is trying to do this and the system says, well, it's nice, but we don't reimburse that kind of thing. As a matter of fact, you just violated 2 of the accreditation standards and you will lose your license. That's not good. So we have to recognize that evidence-based programs and practices are new ways of work. Those new ways of work do not fit in current systems. Current systems are designed to produce our current results, and those are exactly the results we are trying to modify. So these enabling contexts are very, very important. And all of that is there to produce socially significant outcomes. Statistical significance is wonderful, but this has to make a difference. This has to be the kind of thing that the patients, that the students, it is a noticeable thing. It's not something you have to go in and you know, the mother's eye effect we all learned in graduate school. This has to be going in, you say, wow, what happened here? That's what we're looking for socially significant outcomes. Notice in this formula, it is multiplication. What happens if any one of these factors is 0, the result is, yeah, 0. Thank you. I knew there were some mathematician type folks here in the room. So, if we have, and I'm not implying that it's anything as precise as math here, but if any of these factors are not very strong, our results will not be very good. And so, but we have to be thinking about each of these 3 things as we are looking at implementation. What do we want to do? So let's look at what? Evidence-based programs. We've already heard a lot yesterday and again this morning. If it's effective, we want to use that. I mean, let's take advantage of that. Hearing from our colleagues on the panel this morning, that's exactly what they're up to. And for for those things that are not working, let's stop it. But can we just do that? As Brian was just saying a minute ago, and as we know, every day kids show up at school. Every day the clinic is full of people looking for help. We're going to just say, well, no, we're going to stop all of these ineffective things or ones we have questionable. You go home and wait. We'll send you a note when we finally have the next evidence-based program available. You know, that's not going to happen. So we want to stop it, but we have to stop it. That's why the use it part is there first. We have to create credible alternatives first. Then, as we do that, then we can stop doing some of these other things. What happens next? What are the next steps? We can take those things that we are stopping and repurpose those resources so that we can expand the thing that we do. So how do you do this kind of work in a cost-neutral way? This is how it's done. What is it? This was a question asked yesterday. What is this thing that we want to do more of? Unfortunately, we don't know much about interventions. Here's a whole series of studies over the last 20 years. About 18%, only 18% of these 1,200 plus outcome studies had any assessment of the independent variable. So yes, they have outcomes of something that they wrote about in the method section. Do we know that any of that stuff in the method section was actually there in practice? We don't. We know in 18% of the cases, the rest of the time, it's somebody's guess. So we have putative kinds of things and not things, and even there, we only have 7% of those where we actually have the thing that they measured, the independent variable, linked to outcomes. So we have heard a lot about all the websites looking at evidence and the rigor of evidence, et cetera. But evidence-based programs, what about the program? Where are the websites for that? So for implementation, if we're going to take things to scale, if we're going to do something over and over again, we need to know what that thing is. So here are some criteria for usable interventions. You need to have a clear description of the program. You've heard some of this already this morning. You need to know what the essential functions are. What are those core ingredients that have to be there no matter what? Do we know what to do those core functions? Do we know what to do and say and how to assess that in practice? Do we have a practical way to measure performance? Do we have a practical fidelity assessment? If this is something that we want to do 10,000 times over with lots of parents, lots of communities, lots of places in different parts of the world, we need to have some way to assess whether the intervention is there or not. And so these are and as we just saw, only about 7% of these 1,200 studies have actually correlated those kinds of assessments with outcomes. So we don't know a lot about this, but we need websites devoted to this along with the evidence. So most evidence-based interventions right now really don't meet these usability criteria, but we just have to keep in mind that practitioners, managers, they use interventions. They don't use standards for the rigor of an evaluation. And yet we invest all of our time and energy looking at the rigors of the evaluation. And again, not to take anything away from that. We don't want to stop that. We just have to expand our horizon here and look at programs. These programs are scalable only if we know what they are. So let's look at effective implementation for a second. Lee Shore, I'm sorry she left, but we cite her all the time. Successful programs do not contain the seeds of their own replication. Has to be, somebody has to do something. And this, I think, again, my panelists here this morning were talking about this. What we have the most data on in implementation work are about things that don't work very well. And we have a lot of data on these things because these are the things we do almost always. So consequently, we have a lot of data on it. Diffusion, dissemination of information, training by itself, passing laws, mandates, regulations, funding, organization change and reorganization, all of that. Not to take away anything from these. Every one of these things is very, very important. But when we do them one at a time or we do them poorly, then we are not getting the outcomes we want. We do not have those socially significant results. But we've got a lot of data. Some of the very best data in implementation research world is on these things. Randomized control trials, for example. We can expect 5 to 15% return on our investment in those kinds of activities. So that's not what we're looking for. As Jim told us yesterday, the real secret here is to invent a different future. If we want to know what the future is going to be, let's create it. So the first thing we have to do is stop wasting time and money on things that don't work. All this stuff we just looked at here, we do a lot of. We need to stop that. And it hasn't worked for the last 50 years that I'm aware of, and it's not working today. George Sagai is a good friend of ours, and I've attributed this, and so George doesn't call it Sagai's Law, but I call it Sagai's Law. But for every new initiative that you start, you have to stop 2 current ones. Now this is a showstopper when we're talking to people in positions of authority. You want to do that one thing, you're hot about that, great. What 2 things are you going to stop now in order to fund this, in order to make room for it, in order to fill in the blank? Very, very important. This helps to descale things that are not working. Let's get rid of them, take them down. And it avoids layering and fragmentation, which is a huge problem in all human services. Good Lord. She just said, I have 5 minutes. A solution to this from a policy perspective, 1, we need to start setting aside funds for implementation. If you're going to fund a new initiative, 15% of the funds, and we made this number up, So you know it has a firm foundation in my mind. But something needs to be set aside to create the opportunity to do real implementation work and ask for fidelity data. And twice a year we think is about the right thing. So if you're a policymaker, policymakers keep saying, you talk about all this stuff, it's too complicated, give me 2 things to do. Here are the 2 things we say to policymakers. Set aside the funds and ask for fidelity measure, and within 5 years you're going to transform your field. Fundamental truth in implementation. People cannot benefit from programs they do not experience. We can have it in policy, we can have it in procedure, we can have it in funding, but unless those teachers, those parents, those people who are supposed to be using that intervention are actually using it and using it as intended, it will not produce the outcomes that you want. Back when, well, and so for effective innovations in violence prevention, if we cannot implement them as designed, they will not produce the outcomes that we want. You've seen this. We have policy, we have practice, and right now we kind of expect a miracle to occur in between. And the guy says, I think you should be a little more explicit here in the middle. So that's my task here for the next little bit. I'm going to skip over that one. Going to skip over that one. Here is some of what powers implementation. These are implementation drivers. So as we looked at the literature, evidence-based programs are new ways of work. So somehow or the other, we have to develop the competency of the folks, practitioners, managers, coaches, etc., to do this work. And so what helps to build competency are the selection, training, coaching, performance assessments on that side. We also know that having practitioners do this without the support of organizations is an invitation for short-term programs. So we need to build sustainability by changing programs. And that's on the right-hand side, so the organization drivers. And none of this is going to happen without leadership. But notice all of everything on the triangle, the implementation triangle, culminates in performance assessment, which is our broader term for fidelity. But everything there, why are you doing training? Why are you doing coaching? You're doing it so that practitioners can learn this, do it well, and why are you changing the organization to support all of these activities? You're doing that to support practitioners doing it well. So that's the culmination of that. And if we can get high fidelity, then we're going to get what our panelists were talking about here. We're going to get consistent uses of these innovations in practice. If we can get that, we are going to reliably be able to produce the benefits that we want. But notice what happens if you take fidelity out of there. You have disconnected all of these activities. What are the good and bad outcomes that you're getting there at the top, these reliable benefits? What do they do to? Don't really know without fidelity. So fidelity is critical. Does it make a difference? These things that are on the implementation triangle, 20 minutes left, thank you. If you do training by itself, as I said, not very effective. That's where you get about 5% return. This is a meta-analysis done by Joyce and Showers a few years back. You add coaching, you do your selection or your training, now you have coaching there. Now you can expect about 95%. So what do we want? Do we want 5%? Do we want 95%? This is where the investment in implementation, these active implementation components is really important. Improvement cycles. There's talk about the kind of slavish, I think was the word, adherence to things. Well, evidence-based programs is not some panacea. Is what we know about this stuff today, is this the best possible thing? Is this optimal? No, it's barely adequate, way better than what we've had in the past. We want to build in improvement as something that is going to be there, and it's built in at the practice level, it's built in at the organizational level, and it's built in at the systems level, which is what those three represent. And I would tell you about them ahead of time. Implementation team. Who does the work of implementation? Right now we have a lot of this information that goes out to people. We say, and good luck with that. Let's hope you're able to make good use of this in South Africa or wherever you happen to be located. Brian talked about the intermediary organization. Now that's there. Now we're talking about implementation teams, a way to start organizing this. And this is very, very important because, as we heard yesterday, the problems that we faced with respect to getting this stuff into practice are everywhere. There are multiple levels of this, multiple factors within each of these levels. Who's going to be paying attention to all of this simultaneously? And Brian just gave a terrific example of that, so I'm going to skip over that. The other thing, if we're going to take things to scale, the data are, and you can see here it says 20%. They've done some look at the readiness for change. About 20% of people and 20% of organizations are ready for change at any given point in time. So if those are the ones that we go to, and we should go there first to start things off, but what about the other 80%? Who's going to get them ready? Who's going to help create readiness? And again, this is the work of an implementation team. Does it make a difference? Here's a good example. We have effective interventions. If you have an intervention or implementation team with the expertise to do the work, you get about 80% of your organizations that you're working with that are able to do this work well. Takes about 3, maybe 4 years. Without that, the data say if you just put it out there, you're going to let it happen, help it happen. It takes a long time, and you get modest success, which is not going to help us with scaling. Also, if you have an implementation team, you get sustainability. The difference between 15% on the left-hand side to 85% on the right-hand side for a number of organizations, it makes a big difference. If we're going to invest all this time, energy into doing this work, then we want it to last more than the time, and this is for 6 years or more. So where, and I know I'm going over by 1 minute, but I'm almost there. We had discussion yesterday about politicians and policymakers, and I'd just like to give you one of Karen Blasie's quotes. The plural of anecdote is, okay, you flunked that one. It's policy. That's what it is. It was very interesting in the Great Society days, which is the previous incarnation of evidence-based program movement, when they looked to see what was it that policymakers at federal, state levels paid attention to. They had a list of 15 factors they were asking about. Data came out 13th on the 15. So this was not the case where you would have a hearing, researchers would come there, politicians then would go to the cocktail party afterwards and say, God, these guys came in today, you should have seen the effect sizes. I mean, I've never seen this. I mean, usually I'm looking at 0.8, 0.9. These were like, I mean, Brian brought in 1.7. Can you believe that? I mean, is this going to be cocktail party? No. This mother came in today and her child, I mean, you know how it goes. Remember, who we're talking to, how we talk to them. We're not going to convince them to be consumers of data. We need to know what we are talking about so we can present good examples and to get the, so system, and we're right at the end of Polly, so right now we have innovations being introduced into current systems. Current systems, as we just noted, are not set up to deal with innovation. They're set up to deal with what they're doing right now, producing those outcomes. That's how the entire thing, soup to nuts, is set up. It crushes. You know, your 12-step program, I'm sorry, we only have time for 6. You know, I'm glad you have that, but, you know, it just doesn't fit here. So what we have to do is start and say, no, this is critical. It's really what Brian was just talking about for Pennsylvania. It's critical that we have this. Now, how can we start changing the system to fit this new way of work, these new ways of work called effective innovations? Why do we want to do this? Back up one. because we want those socially significant benefits. It is all worthwhile to invest in this stuff. What it is we want to do, how we're going to do it, who's going to do the work, where are we going to do this, creating these enabling environments, that is what's going to produce the kind of outcomes that we want. Right now, we have a lot of programs that have gone on the supply side of things. These are brought to us by the program developers. They say, here's what is required. And so people have gone to where they are most welcome. And don't blame them a bit. That's that 20% we looked at a minute ago. But if we want to have this have population impact, we want not just the kids in the best schools to get benefit of this. We want all 55, 60 million kids in the United States of America schools to benefit. That means we have to go where they're most needed. That's where the implementation team creating readiness and building in this capacity is so important. And if you like any of this stuff, come to the Global Implementation Conference. We had one here in Washington, D.C. 2 years ago. This year, August 19, 21, is the next one. If you just Google GIC, you will find us. And it is a fantastic event and truly global. And a big part of it this year is going to be on scaling, along with a few other things that there are 9 major topics, but it's about how to do this work. So thank you very much.